It will not be a tummy tuck, but rather a tummy tuck extending to about 270 degrees. I am not considering a 360-degree tummy tuck because our patient does not have that much sagging.
Turn around if you like. And now in tummy tuck, I always say we do tummy tuck for 4 purposes. If there is sagging, if there are stretch marks, if the front abdominal wall is loose, if the genital area is down, it is a process we perform. Now, is there sagging? Yes, there is. When we remove the fat, it will sag even more. Moreover, you see the accumulation at the top. Along with this, the front abdominal wall is loose and the genital area has descended downward. These need to be lifted upward. Therefore, a tummy tuck is necessary for this patient. Apart from this, to correct the protrusions you see on the sides, normally I would extend the tummy tuck a bit here to remove the excess tissue there. At least let it be a 270-degree tummy tuck. I don't want 360 because there's no situation for 360. Again, in tummy tucks for this type of patient, sometimes we also cut from the front. We call this a fleur-de-lis in a T shape. Our patient doesn't need that because I will remove fat. Once the fat is removed, these areas will automatically slim down. I believe our patient will achieve the desired smooth form. In short, friends, this is what we do for 90% of patients with normal classic tummy tuck techniques. We are already correcting the front part of the abdominal wall directly. In some patients, we add a fleur-de-lis. Look, this is something different. Sometimes we do a mini tummy tuck. Sometimes we go 360 degrees with the tummy tuck. But for this patient, I am planning a 270-degree tummy tuck. We also have some surgeries called reverse tummy tuck, but we are not considering this for our patient because the standard tummy tuck will already give us the desired result. If she saw the thigh lift topic, she would want us to do it now, but our patient did not want this. We will address her arms and breasts later. I can also do the thigh lift at that time if she wants. What I'm actually trying to say, friends, is that if such a surgery is to be planned, it should be considered very carefully and planned very well. The patient's expectations need to align with what the doctor can do. We actually matched 90% with our patient. I would have preferred to do a thigh lift, but our patient doesn't want it. I respect that here. Ultimately, the patient's expectation and desire are very important here, in my opinion. So the patient has some thoughts about the scar. I actually said the scar wouldn't be too bad, but still, our patient wanted it this way.
It can always be done later. In that sense, there is no problem.
They are planning the arm and chest issue for later. Right now, we will start by doing this procedure. I always compare this work to something, friends. It's not like building a regular building. It's like constructing a skyscraper. It must be very well planned. Action should be swift. If performed gently without distressing the patient or conducting traumatic surgery, we will achieve an extremely effective and beautiful result. Our patient will definitely stay in the hospital for 2 or 3 days. After that, we will discharge the patient. By the way, our patient is coming from afar, but ultimately, after being discharged, we will ask the patient to come for a follow-up.